Welcome to our second summit, sponsored by the Philippine College of Chest Physicians and the Council on Health and Integrative Medicine. Our council was formerly known as the Council on Complementary and Alternative Medicine. This is the old name, CAM, and now we are called CHIMe. This council, headed by our chair, Dr. Parkash Mansukhani, together with a number of members from the different society chapters, was founded in 2001 and since has actively participated in the activities of the college. This is an old slide, but the members there are looking young. In our daily medical practice, we frequently encounter the problem of treatment preferences. Some patients readily comply with our prescriptions, but a number prefer to go natural and instead take alternative medications such as herbal medicines and other similar preparations, which in terms of therapy sometimes do not prove to be effective or safe. Because of this, there exists the need to educate ourselves on how to approach this alternative field, short of the standard protocols that we follow in mainstream medicine. Several years ago, on August 19, 2004, then President Gloria Macapagal Arroyo signed into law Proclamation number 698, declaring the month of November as the Traditional and Alternative Health Month. This is in line with Republic Act 8423, or the TAMA, Traditional and Alternative Medicine Act of 1997, which provides that it is the policy of the state to improve the quality and delivery of healthcare services to the Filipino people through the development of traditional and alternative healthcare systems and its integration into national healthcare delivery program. In this direction, then named CAM Council, our council, convened its first summit in the month of November 2010, the 26th to be exact, at the Alvear Hall, UP Manila. This was entitled Palay at the Hip, the objective of which was to educate the Filipinos on the role of complementary and alternative medicine in patient care. That was the terminology used, however, through the years. The CAM has evolved into integrative medicine, the term we use nowadays. This is the field that is able to combine both Western medicine with the currently accepted alternative forms of treatment seen to be safe and effective, in contrast to just plain alternative medicine alone. Lest we forget, we bring to mind the objectives of this council, which are as follows: to educate the Filipinos, both laymen and physicians, on the role of integrative medicine in patient care. This was the aim of the first summit. Second is to strengthen the values in medical education. And third is to educate the Filipinos on how to choose the appropriate therapy from a simplified evidence-based approach, which is the aim of this second one, this summit that we are now having, aptly entitled, Paano Piliin ang Magaling sa Kontra o Palpak. Meanwhile, the council continued its activities and regularly participated in the annual conventions of the college through scientific symposia, all in the interest of promoting awareness of such treatment modalities. We are happy to inform you that the other contributions of our council include the following: 2 validated questionnaires on the CAP, or the knowledge, attitudes, and practices in integrative medicine among patients and among physicians, a bookmark that has published the principles of holistic medicine distributed to the CHIMe members, and the third, is the adoption of the poster on the no approved therapeutic claim from the PCP Southern Mindanao chapter. The Tagalog version, ito ay hindi gamot, is the one that we hear over DZMM, teleradyo, following advertisements on food supplements. The Council would also like to reiterate its stand on the use of lagundi, scientifically named Vitex negundo. Based on a review of the available data in 2010, our Council finds that there is insufficient evidence, clinical evidence, to recommend the use of lagundi for cough in adults. It does not recommend the use of lagundi as a bronchodilator for asthma. For today's whole-day summit, we have invited speakers for the 4 plenary sessions and 4 panel discussions. Among them, our former Health Secretary, Dr. Esperanza Cabral, to update us regarding the no-approved therapeutic claim topic. Stem cell specialists, Dr. Antonio Dans, former PMA President, Attorney Leo Olarte, PCCP past President, Dr. Abundio Balgos, to talk on his special field, noted researcher, Dr. Francisco Heralde, another former Health Secretary, Dr. CHIMe Galvestan, and many others, all experts in their fields of practice. Added to this is a luncheon symposium on the myths and misconceptions of vaccines by Dr. Mayan Lumandas. Although we were able to get hold of an oncologist for our first plenary, Dr. Omid Etemadi, he could not come due to conflict in his schedule. So we would like to give you his audiovisual presentation version, a model of his comprehensive cancer care. Last but not the least is the fact that we are videotaping this conference and making this and the slides of the talks available through our PCCP website for free. This would make it accessible to anyone who would need to decide on a rational and appropriate choice of therapy. We believe that this is a very noble cause, as this would benefit the majority of our countrymen who are financially challenged and who do not have access to adequate healthcare resources. At this point, may we thank immensely the University of Santo Tomas for this wonderful venue. Let's give him a big hand. And also the PCCP and its members for continuously supporting us. To the organizing committee and the secretariat, special mention Ms. Joanne Silva for her patience and dedication in following up everything. The speakers for taking time out from their busy schedules just to join us in this memorable event. To our council members for being with us up to the end. To our dear sponsors for their generosity, and to the Most Holy One for making all these possible. Let us give them, all of them, a big, big hand. With this handful of significant contributions, let us make the most out of this summit, as our council has decided that this would be our last year, although there is a suggestion to replace it with another ad hoc council, the Council on Pharmacovigilance. To the next team, we wish them well in this endeavor. There is more to be done, but with PCCP support, we are confident of success. That ends the opening remarks.